Let us now go to visual diagnosis of the skin. The topic is fissures, skin ulcers, and dermographism. A fissure or a crack is a linear split in the epidermis, often just extending into the dermis. From the Chinese point of view, fissures are due to a disharmony of qi and blood deficiency, or kidney deficiency. An ulcer is a circumscribed area of skin loss extending through the epidermis into the dermis. Ulcers are usually the result of impairment of the vascular nutrient supply to the skin, often due to peripheral arterial disease. Ulcer formation is preceded by itching, pain, erythema, edema, breakage of the skin, and oozing. When the ulcer is formed, there is loss of epidermis. As the ulcer progresses, the opening becomes wider and deeper. In Chinese medicine, two types of ulcers are described. Yang ulcers, which have edges that protrude clearly and are clearly defined and are shaped like a basin. And yin ulcers, which do not have protruding edges, are shallower, have edges that are not clearly defined, and produce more oozing. Yang ulcers are predominantly caused by a full condition and have a better prognosis than yin ulcers, which are characterized by a mixture of deficiency and excess. The main patterns giving rise to ulcers are accumulation of damp heat, spleen qi deficiency with dampness, qi stagnation and blood stasis, and liver and kidney deficiency. Ulcers caused by damp heat are characterized by hardened and rounded edges and oozing of a thick yellow fluid. Ulcers caused by spleen qi deficiency with dampness are characterized by a grayish-white tissue inside the ulcer and oozing of a clear fluid, while ulcers caused by qi stagnation and blood stasis are characterized by surrounding skin swelling with a purple color with pain and varicosities, and ulcers caused by liver and kidney deficiency are characterized by deep red surrounding skin and the absence of pain. As a symptom for skin ulcers, when it is hardened with round edges and oozing of thick yellow fluids, it is caused by damp heat. If it is grayish-white tissue and oozing of clear fluid, it is spleen qi deficiency with dampness. If there is swelling of surrounding skin, purple color, pain, and varicosities, it is caused by qi stagnation or blood stasis. When it is deep red surrounding the skin and no pain, it is caused by liver and kidney deficiency. Dermographism, literally meaning writing on the skin, indicates the red wheals that may appear when the skin is stroked with a hard object, such as the end of a pencil or a nail. From the Western point of view, this is due to the exaggerated release of histamine from the mast cells in the skin. It occurs in atopic individuals and is due to the presence of abnormal levels of immunoglobulin E around the mast cells of the skin. From a Chinese perspective, dermographism indicates the presence of wind in the skin, often wind heat. If the patient suffers from atopic eczema, it indicates that wind heat predominates, and if the patient suffers from allergic asthma, it indicates that there is wind and heat in the lungs. Thank you so much for your attention.